Welcome to episode 17 in the KIPS Personal Trainer Application Podcast. My name is Tyler Valencia. I'm the president of KIPS and Kettlebell Concepts. In this episode, we have the owner and developer of Bodyblade, Bruce Hymanson. By trade, Bruce is a physical therapist and educator, but through his innovative approach to movement, he developed the Bodyblade roughly 30 years ago. Throughout this episode, Bruce shares his approach to patient rehab and his journey to developing the Bodyblade. Let's get to the episode. Prior to recording, you and I had discussions about the Bodyblade and kind of why you wanted to develop the Bodyblade. Were your first intentions to develop a product that you could sell on a global level?
No, actually, Bodyblade actually was an opportunity. It was a way for me to try to improve the way I could provide treatment, training, consistency for my patients. In my early days, I was at Northridge Rehab in the San Fernando Valley in California, and I was a member of the trauma team. We would treat spinal cord injury, head injury, stroke primarily. We had a heliport. It was the regional spinal center at the time. So, we had some serious emergency trauma that came to us. Mm-hmm. And then after surgery, they would stay and we would provide rehabilitation for them. And so, neuro in particular was, whether you would call it my specialty or an area in treatment that I loved, because there was so much depth to it, and it applied to all patients really from that approach, which was established early on in my training as a physical therapist. But Bodyblade was really something that was created out of what I would consider a need for my patients, and a way for me to try to codify or reproduce the ability to treat across the board for any patient. And it could even be used with other physical therapists at the time, mm-hmm. To be able to consistently treat our patients. And that goes back to, as I say, to the beginning for me. I was very fortunate in my physical therapy education to have one of my teachers, mentors, who had just come back from spending 2 years in Germany at the University of Heidelberg. Mm. And she worked with Klein Fogelbach, who many people would say is the mother of the Swiss ball.
Oh, wow.
We treated our patients. We learned in our therapeutic exercise not to have our patients lying prone or supine on a plinth, but rather to be on an unstable surface on a ball. So she learned they would take stroke patients, head injuries, spinal cord injuries, just ironically, what I had the privilege to work and treat when I graduated from school. But in our therapeutic exercise courses, that's exactly what we learned. We learned to put our patients, regardless of the etiology, the diagnosis, could have been a shoulder patient, could have been a hip, knee, ankle, could have been a sprained ankle. We'd put them on a ball. And learned very early on about providing instability to bring about stability in the body, to challenge the brain and the neuromuscular system to work together. So that was the evolution of what we called, I graduated from physical therapy school in 1977. So we're going back to 1975, 1976, 1977 of my therapeutic training. And in those days, we learned to treat the body, train the body from the center out. So core stability, that's, I hate to use the word a garbage term today, because so many people use the words inappropriately, or what does that really mean? Doing sit-ups and training the rectus? Oh, I'm doing core training. What we learned about core training was to build the body from the center out. And what I always like to say is that everything from the neck to the pelvic floor is the core. Mm-hmm. And that includes a lot of muscularity, a lot of joints, mm-hmm. The entire spine, the shoulder, the pelvis. There's so much that's truly connected to the core. And that's what we learned. That's how we established our treatment, our protocols for our patients. And that's how we used it to evaluate the needs of our patients at the same time through assessment of trunk control, trunk stabilization, core stabilization. And so when I graduated, interestingly enough, when I had graduated from physical therapy school and came back to the West Coast, people would see me in the clinic putting critical, very challenged patients that sometimes needed 2 or 3 people to help them sit on a ball, using a ball. And they said, what are you doing? You know, you're using a ball. And yeah. And so it was a very unique and foreign application to training when I came back to the West Coast here in 1977. I actually started teaching classes on using the ball for UCLA and USC and California State University of Northridge physical therapy students. It was a wonderful opportunity to share what I had learned. It was just an opportunity for me to be in the right place at the right time and to have the incredible teachers that I had to take us away from what you might consider tradition or recipe types of approach to treatment or training. So basically the Bodyblade was an extension of that environment of being able to provide instability on the most stable surface that we know, which is the planet. And to be able to do that using 3 planes of motion, to be able to engage an individual who has no mobility, has no motors to move to a certain degree. It was an opportunity to try to duplicate the environment of being on a ball. Mm-hmm. And that's how it started for me. That's how, I had my criteria. I had my wish list of how can I help this individual? How can I create instability? Even when they were lying supine in a hospital bed, how could I activate the neuromuscular system? And how could I activate those deep, deep stabilizing muscles before we move the dynamic muscles? How could we provide stability before mobility? How could we have that at the spinal cord level before we start training in a quote traditional sense? And I want you to know also, if you think of all of us, we are all the same. We have the same nervous system, and we all fall along this spectrum of training or ability, from those who need the most help to, on the other end of that spectrum, the world's best athletes, in Olympic athletes, the elite, who have dedicated their lives to professional sports, whatever it might be. Makes no difference. My approach to that individual, that world-class athlete, is exactly the same as it would be for an acute trauma patient that I would see, because all of the principles apply. And then it was just a matter of almost a year of testing and of fine-tuning to get the Bodyblade to do what it needed to do for me, and how it became what it is today. So, yeah, and that's 30 years ago.
Wow. Wow.
30 years ago, 1991 is when I first introduced the Bodyblade for my peers, at a national convention for the American Physical Therapy Association, and that was quite an experience, I'll tell you. But I'm sure you're familiar with the term paradigm shift. A paradigm is a change from what is a well-established norm. And, whoever is that individual or whoever is that entity that is the paradigm shifter, they've got to overcome a lot of resistance to change.
Yeah.
You've got people saying, well, we've been doing it this way for a long time, and why should I even bother considering what you're presenting? Because we don't do that. And that you have to overcome that. So it was a challenge to help. Really, it was an opportunity to educate.
Yeah.
People understand what I was presenting, and how this could be an alternative. It's not to say stop what you're doing, now do this, but rather be open to something adjunctive that you could introduce in your own treatment, your own training, for all of your patients or clients. And then from there, if we expanded into the athletic trainers and strength coaches and a lot of professional organizations, and then also through my teaching and my training, and really a wonderful period of time in the 90s, when there was a transformation, if you will, in the way we approached treatment and training. Nothing wrong with tradition at all, but let's talk function.
Yeah.
Let's not isolate body parts or look at the human body in isolation with tunnel vision. Let's look at this beautiful temple of ours from a functional perspective. How do we move? How do the 3 planes of motion come into play? How do we build the body to be stable before we're mobile? Start answering all of these key questions that are critical, not only for treatment, but for protecting the joints and activating the neuromuscular system the way it wants to be activated to be successful.
Oh, yeah.
We have 610 functional muscles in the body. So think about for a moment, each one of these muscles is talking to the rest of them. Imagine putting 610 people in a room and saying, okay, guys, let's talk. And now everybody's chattering and talking to their neighbors and figuring out what I'm doing, what you're doing, let's catch up. And that's basically what your nervous system is doing all day long in milliseconds. Having this exquisite conversation with your muscular system, which is very simply the motors. They're the motors that move you. I always say, if you could unzip your muscles and hang them in the closet, you would just be a bag of bones without the ability to move. There you are. There you sit. Bones hung in the closet, and your motor is sitting right next to it. They've got to work together. But anyway, I'm getting off on a tangent, but
it's a good tangent, though. It's a very good tangent, and we'll come back to actually what you mentioned about core training and core stability. That is a very interesting topic that you and I share similar views on. So we'll definitely be coming back to that. And I thought it was great that you talked about the state of physical therapy when you were introducing the Bodyblade. And I would say even experiences that I've had within physical therapy, there's always, I even worked, one of my first jobs actually was being a physical therapy aide. And from my experiences of being an aide, but then also going to physical therapy for past injuries, I feel like the quality physical therapists that I've worked with, they always had some type of modality that they, I'll say, made their own, or they kind of just altered it just a bit for what they wanted to utilize with it. I like that. I enjoy that. And with your product, was there a point when you were like, okay, this can be something that I can distribute globally? Did you have that moment?
Well, not like that. When I was first being in the Los Angeles area, you can imagine all of the rehab centers that are in this area, and some really well-known physicians and rehab groups. For example, Curlin and Joe was out here, and we had UCLA and USC, and my peers, my friends who are also physical therapists, when I initially started, and I was using it with my own patients and getting positive results that I was excited about, I thought I have to give some body blades out to my friends. And I would just simply let them know that treat your spine patients, your shoulder patients. Here's some of the things that I do with my patients, and please test it. Let me know your thoughts, because these are the types of results that I've been able to achieve, and I would love your feedback. And so over the course of about 3 months, the feedback that I was getting from pretty much everyone was that this thing works. It does exactly what you say it does. And, the patients will tell you that they're moving better, they're feeling better, they're performing better, their pain level has dropped, or we were using it for the shoulder, but then their cervical spine improved. And they were pleasantly surprised about the additional benefits that their patients were achieving, which just confirmed for me that it does take a global approach to the body. And you may focus on the shoulder, but there's going to be an effect in the lumbar spine as well. Mm-hmm. Or you may be thinking about the knee, but why would the hip improve? Why would the ankle improve? What is going on here? And so that was the first time that I realized that, okay, it's not just me, it was my idea. It was my passion. You fall in love with your product sometimes and your goals. But then when you get that feedback from your peers, that validates what you're thinking. It was at that point that I thought, now it's time to introduce this product to my peers and start thinking about manufacturing. And that took on a whole new challenge.
I'll bet.
As a physical therapist, I was not at all familiar with what it took to manufacture something, mass produce something, and then market it, sell it. That's a whole different world. Oh, yeah. And believe me, I made many, many mistakes along the way. And, it's funny because I think ignorance is bliss sometimes, because if I had known then what I know today, I would have taken a completely different approach to how I would have entered into the entrepreneurial side of now manufacturing a piece of exercise equipment or a training tool to share with the world, if you will. Mm-hmm. But it was an evolution that, it's still evolving, but I would say over the course of 4 or 5 years, I realized that even though I wasn't necessarily marketing to strength coaches initially, or the professional ranks in athletics, that those people involved with training athletes were learning about it. Mm-hmm. They were starting to use it and experiencing the benefits as well. So it was almost as though I was pulled into it because of those people who were experiencing the product and wanted to know more about it.
Mm-hmm. Oh yeah, and I think what's great to hear about that is your connection to the education with it. I think that was something that caught my ear when we had previously discussed Bodyblade, discussed this podcast. It was that we both shared an affinity for education and how to get knowledge out to the masses. And
Hmm.
with the item that caught my eye the most was when we talked about multiplanar movements and
Yes.
movement. And that is actually something that I would consider that is making a resurgence of lately within the industry. Uh, when we typical individual thinks of exercise, they think of isolated bodybuilding, their bicep curls, their bench press. But when we look at movement, we think about tools that can help them, and then we've discussed several of them. And the Bodyblade, in my opinion, fits right in there. And I've used it in that capacity as well, in my own training. And so with your experience and also with how you developed it, was developing a multiplanar tool what you originally had in mind?
Well, that's really a two-part question. The multi-directional movement, or what I would refer to as the three planes of motion.
Mm-hmm.
I was initially thinking, as a physical therapist,
Mm-hmm.
that my approach was to speak to my peers initially.
Yeah.
And now, again, today, being smarter, I perhaps would have expanded my field of connection or education. But at the time, as a physical therapist, I wanted to talk to my peers and say, "Hey, this is what I'm doing with my patients. Maybe this is something you can do with your patients."
Yeah.
And then, as I said a little earlier, it was almost that the shared information, some of the seminars that I might be part of or speak with at the time, or do a guest talk for an hour and a half. There was a lot of people there. You would have athletic trainers certified. You would have strength coaches, conditioning specialists, kinesiologists, exercise physiologists. There was a fairly large gamut of health professionals, and that would attend, and they take this information back to their own groups, and before you know it, it's like throwing a little pebble in a nice glassy pond, and then you see how the rings expand.
Mm-hmm.
And then imagine throwing 2 or 3 pebbles in the pond, and now you've got these 2 or 3 overlapping puddles interacting with each other. And then it was a focus. I would go to the trainers conferences, and then I would start expanding where I would go, or accepting opportunities to work with some other incredible people like Gary Gray. Gary Gray's been a friend of mine for 30 years, and somebody that I have tremendous respect for as well. But you get to know some of the people who are having similar conversations. And so today, I want to talk to everybody who will listen, and if you get back to the basics here, what are we doing here? What our goal as health practitioners? We're in a position to help people have a better life. We're in a position to help people enjoy life, to have better movement, to help decrease pain, to help improve function, to be able to celebrate their families, and enjoy life. I mean, this is the goal. This is what our training gives us. It gives us the opportunity to help those who may need to improve something in their life. And, it's a very interesting crossover at the same time. And I was talking to my son about this the other day. Just because there's an area of conversation sometimes that is not necessarily what you would consider your area of expertise, but you have knowledge about something else. So the longer you are a professional at what you do, you learn more, which as long as you in my opinion, you can stay within your own wheelhouse. But if you have information to share with somebody that helps them to get to another place, then I feel it's almost our duty to share things along the way that you learn yourself, as long as you stay within your area of expertise and don't start trying to cross over. But if you learn something that pertains to nutrition, or when someone has a misconception about something and you can direct them in the right place to learn more about what's really appropriate, why not share that information? That's, being a physical therapist for 40 years plus, you pick things up along the way. And, I feel it's an opportunity. It's a gift. It's a gift to be able to share what you know, to help spark more questions, or the ability to learn something for someone that's going to ultimately say, I never even thought about that, but thank you for giving me that direction where I can learn more about it, make a difference in my life. But anyway, coming back to multi-directional, or what I call the planes of motion. And again, that comes back to my education in therapeutic exercise. Everything we do, we are in a triplane environment. We don't isolate and move in one plane. And I say this, for example, you were just talking about weight training and isolation, and this is nothing against, quote, tradition. If that's what people love to do, well, fine. But for me, I am kind of on the opposite end of that spectrum. I'm about function and movement, as putting all of that together in all three planes of motion. So if we want to focus on the physical planes, for example, for those who are interested in if I break this down, the physical planes of sagittal plane, which divides the body into left and right halves, if you will, or that physical sagittal plane can move to the left or to the right, could even be outside of the body, but still it's that sagittal plane. So if you were standing against the wall, for example, and your shoulder was on the wall, that's the sagittal plane. Then the frontal plane, which would divide your body into front and rear portions. And if you were with your back against the wall, that's the frontal plane. And then, of course, the transverse plane, which would divide the body into upper and lower parts, or anywhere along that spectrum. If you're standing on the floor, you're standing on the transverse plane. Mm-hmm. So then think about movement now. So that's the physical plane. But then the movement plane, if you're moving in a sagittal plane, you're moving in a forward to back motion. Mm-hmm. And if you're moving in the frontal plane, you're moving from a left to right environment. Or in the transverse plane, you're moving in rotation along the long axis of your body. Mm-hmm. Now, the beautiful thing here is that when I look at this movement spectrum and bringing all three planes of motion together, you can do it with gravity, or you can tell gravity to take a hike. And you can do this within the body itself and without any gravity. In fact, we train the astronauts in a 0G environment on how to train their body in space. Because when it comes to using your body in a triplane environment, you don't need gravity to achieve that goal. But anyway, coming back to those functional movements and functional planes, you never move in just the sagittal plane. Mm-hmm. So for example, if you were standing and step into a forward lunge and then back to your standing, let's say you have a wide base of support and then you step forward into a lunge and come back. Well, you're moving in the sagittal plane, no question about it. And let's even say that may be your predominant plane. But you're also using your frontal plane and transverse plane muscle as well to stabilize while you're moving through the sagittal plane. So you're never escaping or void of a triplane environment. Or if you do a lateral lunge and then back to the center, or you may if you're standing with let's say a wide base of support, and you take your right leg, step forward across the left side of your body. Well, now you're introducing a transverse plane movement, but you still have to stabilize or co-stabilize, if you will, in that sagittal and frontal plane environment. So you're constantly interacting in a triplane perspective.
Oh yeah.
And then when you think of what the muscles do, for example, you're adding. Are you an agonist or an antagonist? Are you a fixator or are you a co-contractor? And how do they work in synergy? What's going on? The very simple movement that we're just talking about. There's so much going on in the body that when you have the proper education to think about and analyze how the body moves, or let's say you have an individual with hip weakness, and how are you going to train that hip? Well, you could think about it from a traditional sense of let's side lie and do abduction exercise. Let's do 10 reps. Well, why not stand up if they're capable of standing and start doing some rotational steps? Or even starting in a more simple, just let's not do rotation straight away, because I believe that rotation is one of the more complex planes to train in. Let's just do some simple step forward, step back, sagittal plane exercise, for example, and then move into the frontal plane. With Bodyblade, we have rules of progression, but also those rules of progression, I believe, apply in general. I usually like to say sagittal plane before frontal, before transverse, because it requires, as you progress through the planes, it also requires more stability before you can be mobile. Mm-hmm. And so I like to take people through a sequence that way. But it's impossible, from my perspective and from my approach to treatment and training, not to consider a triplane environment, a multi-directional plane as you've described. Mm-hmm. It's impossible not to include that. And so for a lot of people, when I teach, initially that's a difficult concept to understand. Well, is this a sagittal plane movement? Is this a frontal plane movement? Or how can I activate the hip, the knee, the ankle, the shoulder in these particular planes of motion? So how does that relate? How do I incorporate a treatment or training regimen that needs to address these three planes of motion? And that's where your skills come in to evaluate what's in front of you. What does the patient or client present?
Oh yeah, I would say that is part of the evolution of a fitness professional. And you could even look at the different entry levels, and I'll take the personal trainer perspective since that's where I come from. When a personal trainer first enters the industry, they preliminary think about just doing bicep curls, chest presses. Okay, what is that primary muscle that they're utilizing? But I believe it was Tom Purvis. Mm-hmm. He has a video on YouTube about isolation and certain exercises. And the example that he used, which I think is a good one, he was using bicep curls, but he's saying, well, what's happening with the core? What's happening with your legs if you weren't using your legs? If you weren't using your core to stabilize, you would essentially just be mush on the ground. And I think that those are not the exact words that he used, but in terms of just thinking about it, there is no, I'll say true isolation was the point that he was getting at, and that you have to engage other muscles that are in different planes in order to perform certain quote unquote isolated exercises. And I think that goes along with the evolution of certain individuals, because they learn, okay, when I'm going to set a client up or a patient up on an exercise, what are the other joints doing? How are they interacting with their environment, how are forces acting on their body. And so with going through the industry, I always think it's very interesting what different professionals from different spectrums, how they approach certain exercises, or even the language that they speak. Strength coaches, physical therapists, athletic trainers, personal trainers, they all have a different, I would say not a very big difference in terms of their approach,
Mm-hmm.
but the terminology sometimes varies. And I think something interesting right now would be, just based off our conversations and also so far what you've shared, is your approach, I'll say, to something very common, such as low back pain. That is something that every client, whether it's a personal trainer or even a physical therapist, that at some point they're going to have to deal with a client or a patient that has some sort of low back pain. Can you share can you share your approach to low back pain, and even what that client might go through if they walk into your clinic?
Well, low back pain, as you know, it's a very common complaint from people, from patients, clients, all of us. At some point, I would say back pain is something that we are all familiar with or have experienced. For me as a physical therapist, in working with so many different people, there's so much to consider. And first, I think what's potentially most valuable is the proper assessment.
Yeah.
You need to do a physical examination of the person. You need to listen. You need to be a very good listener. I think the more we do, the more we learn, the more we know. We also may think we know the answer right away. Just by watching somebody walk into the clinic, sometimes I know a lot about what the problem is without even saying hello. But that can be dangerous too. You need to be less assuming and more of a great listener. And so that's part of the evaluation, is to listen to what your client has to say about, why are you here? Why do you have back pain? Tell me about yourself. Tell me, what are you doing? What have you been doing? What hurts? When does it hurt? Why does it hurt? And you need to spend an hour with that individual, obtaining as much information, medical history, from them, and then incorporating that with your physical assessment of their body, their flexibility. Where are they limited? Are they limited in flexion, extension, lateral flexion, rotation? If they raise their arm over their head, does that activate and bother their low back? If they're standing on one leg, if you're testing single leg balance, does that aggravate the hip on the opposite side of where their pain is? So you need to assess everything you can about that individual, because let's face it, you've got trauma potentially, you've got arthritis, congenital problems that people are born with and have been managing their whole life. So imagine they could have a scoliosis in the spine, they could have adaptive shortening on one side of the body, which is now maybe 30 years into their life causing real problems. You've got social environment, work environment, gravity, for goodness sakes, gravity. The enemy on this planet is gravity. Improper training, poor training. And think about body awareness. I'm sure we could all, as professionals, agree that sometimes we see somebody standing in line with their knees locked out and they're just kind of hanging back on their hip and their ligaments, with a rounded back and a rounded shoulder. You can almost predict that if this person doesn't have back pain, they will have back pain. So it's that poor body awareness. So all of this, in my opinion, is what is important to determine, assess, evaluate, and then we start to treat or train that client. Plus, we need to educate them as well on the things that they may be doing that needs to change. For example, we may hear from a surgeon who is constantly standing over their patient doing surgery for 6 hours, or sitting in a chair, like a dentist, for example, and they have mid back pain, thoracic pain, low back pain. Well, why? Why? We determined that they're slouching. They're not using their erector spinae. They're not using their postural muscles correctly. They're not engaging those muscles. And they go just the opposite. They sometimes will share with me that they wear one of these figure 8 braces to hold their posture. But in essence, what they're doing is they're completely turning off those muscles to do their job. And they're just asking you, please, let me do my job in life. That's what I'm here for. Mm-hmm. So there's so much that goes into the evaluation and the proper treatment, get proper advice, proper exercise regimen for that individual to help them with their low back problems. Even imagine, socially what we as young teenagers go through. We would see young girls, young teenagers who are taller than their friends, and so what they want to fit in, so they slouch. So sometimes when you see them, and now they're maybe late teens or early 20s, and they have tightness in their forward chest muscles, they're rounded in their thoracic spine, they have low back pain, it's because of that social interaction, that environment that they have. Because they're tall, they wanted to make themselves shorter, and the only way they could do that was to slouch forward. And then, of course, look at technology today, where we all sit at a computer, and this is where the enemy comes in with gravity. Our head weighs approximately 10 pounds. So you've got this bowling ball sitting on the top of your shoulders, and every degree that you move forward with the forward head posture, think about the amount of extra work that has to go on in your extensor, the muscles, your multifidus, your erector spinae, the multiple layers that contribute to proper posture in your spine. Look at what that does with a rounded curve. But by the end of the day, if you're just sitting at a computer at work all day and letting gravity take over, you have pain. You have adaptive shortening. You could even have nerve root pain because the vertebrae are sliding or collapsing, or you have a disc problem. You have migration in the disc, and then it touches the nerve root, and then that sends out, the human body wants to protect itself. So if you touch that nerve root, well, the muscles around the spine in that area are going to tighten up. They're going to co-contract. They're going to say, hey, I'm not going to let you move now because that hurts. And so now you have another problem that you need to deal with. So, and I hope I'm not just throwing out so much, but I think it comes back to the proper assessment.
Oh, yeah.
And then addressing the muscularity of the body, posture. Posture is so important. And my theory about posture is that if you're seated, for example, that it has to do, some people might describe good posture as like having a string at the top of your head and you're pulling the string up. And that's fine, but let's go more proximal. Let's go more to the center of the body. Good posture begins with the proper pelvic control. And if you have that slight anterior pelvic tilt, which puts you into the proper lumbar curve, you'll notice that it's almost impossible for you to have a forward head posture. When you set the pelvis in the proper position and the cervical, thoracic, lumbar spine lines up correctly, it's almost impossible to throw your head forward out of alignment. Your shoulders will fall relaxed and down, and your scapula will come together. And so when you start to build that base from the pelvis, now the muscle starts to perform correctly. You realign the body. That 10-pound head, that 10-pound bowling ball comes back over the shoulder. So if you drop a plumb line from the ear, it should pass right through the shoulder joint, which should pass right through the hip joint when you have the proper alignment. And these are the simple things in addition to treatment and helping that patient perhaps achieve a balance of mobility and stability, lengthening muscles that are shortened, shortening muscles that are lengthened, to understand the mechanics of what they're doing at the same time. And then putting together the planes of motion and the simple movements involved with retraining the body and letting them do what they want to do. And so getting back to that conversation that all of the muscles have in the body when they're talking to each other, it's finally the muscles are saying, thank you. Mm-hmm. Now I can do my job. Now I can do what I need to do.
I personally think posture is, I'll say gateway, but also low-hanging fruit for personal trainers in terms of being able to understand where their client is coming from and why they are having certain issues and what goals you can set with them. And that ties right into the assessment, just how you're saying with physical therapists. With personal trainers, the same. Posture can lead into that conversation and open up doors for a fitness professional and where they could take their training. And so with assessments, I think we've even seen a resurgence of assessment certifications and the education being made available about assessments and where that can lead for the industry. It's amazing to see all those types of things come into play just because it opens up more opportunities for the clients or patients and potentially better programming for them. And so segueing into our podcast takeaway, because I think this is going to be the fun one for people listening in, because we both have shared our perspectives. And this is also tie in kind of everything we've discussed in this episode. And so when we look at the education involved with core training, core stability, whatever listeners want to call it, it's one of my favorite parts about reading core research is that as of now, there's no correlation, or that doesn't show athletic performance and core training helps. Nothing exists. There's nothing. Well, we're getting closer. I will say that is something that's interesting. And if you look at research from 20 years ago, 25 years ago, even the way that they defined it, the assessments where they were performing. And I think the issue that we're looking at with core research and athletic performance is that it's hard to replicate in a research setting athletic performance. It's often based off of a stimulus, and therefore the athlete is using people, and this also can potentially open up another can of worms here. People will define agility and they'll confuse agility with change of direction. But with agility, we often see reaction time, and we see that response to a stimulus. So how can you do that inside of a research setting? How can you quantify it, or how can you replicate it? So those are the issues that core research, I'll say, faces. And so the question for you now is, what is your perspective on core training?
Well, I know that there are certainly two camps, those who believe that you need to be rigidly strong and stable, right? Mm-hmm. And then there are those that would subscribe to more fluidity.
Yep.
I guess, if anything, I would fall into the fluidity camp. I believe that to have true core stabilization or to be stable, period, how can you be stable if you can't be stable when you're moving? Mm-hmm. And again, I think there's probably plenty of research to support both, but I'm of the camp of mobility, stability and mobility, stability before mobility, stability and mobility. If you think about all of that, it has to relate to movement and function. But, the other thing that I think we were just touching on also that I think is extremely critically important is power.
Mm-hmm.
I think power is a misused word, and perhaps even misunderstood. I think for a lot of people, power in their mind equates to strength.
Mm-hmm.
Where you hear, well, that person is really powerful,
Mm-hmm.
and what are we looking at? We're looking at an individual who can lift a 400-pound ball and lift it 5 feet. That guy is powerful, right?
Mm-hmm.
Well, strong, but not necessarily powerful. And power has to do, we're talking about force times mass times acceleration divided by time. Now we're talking power. How quickly can you move as a human being? And let's take power down to the real basic here for a moment. Imagine that you're standing in front of a staircase and you want to step up. You want to take your right foot and lift it up to the first step that you're going to take before you lift your body up onto that first step. What has to happen? There has to be the moment that foot comes off of the floor, there has to be an instant reaction in the deep core to stabilize this body before that right leg moves to the step. That's power. Mm-hmm. That's developing some form of activity quickly to stabilize the body before it moves to the next level. Or let's look at this in terms of athletics. Imagine, let's take the game, we could take any sport. We could take, let's say football for a moment. You've got two linemen squared off in front of each other. One weighs 340 pounds and the other weighs 220. And you think, well, the 220-pound lineman, he's got a problem coming his way. Well, but if that 220-pound lineman gets off the line of scrimmage and hits the over 300-pound lineman before he can get himself up, he wins every time. Mm-hmm. And that's because he's developing quickness, power, speed of movement, and the ability to develop that in conjunction with strength. That's the key. So when it comes to core stabilization and training the core, I believe in thinking in terms of power development and functional mobility together. That to me is the basis of proper core stabilization. Let's take a look at somebody like, I hope it's okay to drop a few names here, but let's take a look at somebody like LeBron James, for example. Mm-hmm. He is an incredible athlete. And I know what he devotes his time to doing. He spends a lot of time in power training, so he can control his body quickly, accurately, stabilize before he executes. So you think of plyometrics, but let's just think about what we do. Again, we talk about gravity. If you are moving your body, you have to accelerate, decelerate, stop, stabilize, and do something. So again, looking at basketball, for example, you're running down the court, you now are about to shoot. You have to stop. You have to decelerate that incredible mass of the body, because it's not just about how much you weigh, it's about how much mass your body represents. So you accelerate that mass, you're providing force to accelerate. Then at some point you have to start to decelerate that force. You have to decelerate the mass of your body, and now you have to stabilize it. At the moment you have that stability, which may appear to be instantaneous, there's a lot going on in the body to stabilize. Now you've got this stable mass of a human body, and then you execute this exquisite shot that goes right through the net. So all of that is about being able to be powerful, quick, reactive, stabilize, control the mass of your body, accelerate, decelerate, all of that as quickly as possible. Now that is what core stabilization is. If you're not able to do all of that, if you're not able to bring your client to that level where they can control that, then they're sloppy.
Mm-hmm.
They will look sloppy. They will execute poorly. And that's when they walk into your office and say, I've got back pain,
Mm-hmm.
or I got hip pain. Something's not right. And when you look at those factors, we have to examine power in the body and train for power.
Yeah.
That's critically important.
Right.
And that's part of what was on my list with Bodyblade too. It's all about power. It's all about Newton's laws of inertia. It's all about acceleration and deceleration of the mass in your body. That's the key. And unless, whether we escape gravity, if we're in space, or we train without gravity, the fact is we live in a gravity-rich environment. We have to control our body in that environment, and we have to be powerful and strong and stable in all three planes of motion
Mm-hmm.
to be successful.
I mean, even looking at, let's take back the example you gave with the lineman, and this was actually something that was recently on my mind with the NFL Combine and the analysis of a certain lineman. I think it was a lineman that went to the Giants, and I read an article that said that the pick they took, they considered him weak in his position because he only had X amount of bench presses.
Mm-hmm.
And I thought it was such a funny example to see on ESPN, on a global website that's talking about a certain athlete, and he only performed X amount of bench presses, and therefore he's weak at his position.
Mm-hmm.
Let's take bench press, and then let's compare it to a standing cable press, or even, I don't know the name of the machine, but where they can plate load it and do a standing press. And how does that now translate to the job that a lineman performs? And so if we're looking at correlations between bench press and what a lineman does, or wouldn't it rather be a standing type of cable press or plate loaded press, the correlations right there are probably better. And I've actually had a professor in the past that had some of this data. He's actually now I think he's the performance strength coach for Alabama, and he's really big into data.
Mm-hmm.
And in my opinion, he's one of the best strength coaches out there. But he brought up this example as a question for the students, and this was his own data, and he was talking about the musculature that was activated in a bench press compared to a standing cable press, and what would be better suited for certain athletes. And so I think that's a can of worms right there, talking about the assessments utilized in the combine and why are certain drills utilized. And even looking at the agility drills, change of direction drills, same kind of question comes up. Why are these still utilized? But I take that to something that we've talked about throughout this episode, is the ability for the clinician or the trainer to analyze that data, use it for their clients, or if we're talking about athletes,
Mm-hmm.
assess them in a certain way.
Sure.
So with this episode and wrapping it up, I thought there was so many good points in terms of education, why it's important, how you developed a product, all these great things come into mind, and talking about the planes of motion, so many great things for the listeners to unpack. Bruce, can you give the listeners some information about Bodyblade in terms of where to find them on social media, the website, all that kind of good stuff?
Yes, of course. You can always visit our website at www.bodyblade.com. You can email us as well at moreinfo@bodyblade.com. We will always answer questions and sometimes return phone calls if it's needed as well. On Facebook, at Bodyblade, of course, and Instagram at Bodyblade as well. So those are probably the three best ways to get in touch with us. And again, more info at bodyblade.com, BODYBLADE.
Perfect. And then once things get back to normal, we'll say, in terms of education and workshops, are you looking at putting out more workshops and educational opportunities for physical therapists and personal trainers?
Yes, absolutely. And we haven't spoken about what we're all experiencing on a global level right now with COVID-19. I believe it's in many ways will change how we communicate with each other in terms of seminars and webinars. And so we're looking into that right now and modifying our educational platform and program so we can address education in a way that will satisfy the needs of all of those, from all professionals to consumers as well. So that'll be coming soon. We're in the course of developing those things right now, where we can do more webinars and connections with all people. Absolutely.
Awesome. So Bruce Hymanson, thank you so much for coming on the KIPS Personal Trainer Application Podcast. You shared a ton of great knowledge bombs for everybody, and it was a real honor to speak with you today.
Well, it's an honor to be with you, Tyler. You're a true gentleman, and I look forward to being with you again sometime.
Thank you.